Whenever you place a thread, there are really two types of threads. There's smooth threads, and then there is what we call barbed threads, which grab tissue. So the smooth threads, when I place those, I use those for lines, fine lines like around the eyes, crow's feet, or lip lines, or anywhere that there's just like some crepey skin that needs to be tightened up. So you can use some smooth threads to do that. And I do the smooth threads kind of in a crisscross pattern. And what happens is kind of like a little tic-tac-toe pattern. And so what happens is the thread, your body senses that there's a foreign object in your body, in your face, and it says, oh, well, we need to wall off this foreign body. And so your body sends collagen and growth factors to that area to kind of wall off that foreign body, which is the thread. So side effect of that is the collagen production smooths out the fine lines and the wrinkles, which is what we're hoping for. So with the smooth threads, we're kind of tricking the body into smoothing out the fine lines and the wrinkles that we want to get rid of by inserting the thread. The smooth threads dissolve in about 30 days. The thicker threads, which we call the barbed threads, those threads, the threads are cut with a laser, and the threads go in very, I guess kind of like that, with the barbs all flat when I insert them. And then the threads, I rub back on the threads once they're placed and the barbs pop out. And then those little barbs kind of grab the tissue, and then I pull the thread in such a way to lift the tissue up. Now the thread has, again, collagen that builds around it, and the thicker threads dissolve in about 60 days, but the thread stays up and nice and tight where the collagen has built around it, and it lasts about 1 to 2 years. It's a very nice procedure for several reasons. One, there's no surgery involved. Two, there's essentially no downtime. There's almost zero bruising with it and minimal pain. Most patients say it's a 1 or 2 on a scale of 10. I have had a few patients that say it's maybe a 5, but only for about 2 to 3 seconds.